Understanding adenovirus infection. Causes, signs, symptoms, and treatment. Adenovirus infections are common and can affect people of all ages, leading to a range of illnesses from mild respiratory infections to severe conditions. Here's a comprehensive look at the causes, signs, symptoms, and treatment of adenovirus infections. Causes. Adenoviruses are a group of viruses that can infect the lining of the eyes, airways, lungs, intestines, urinary tract, and nervous system. These viruses are highly contagious and can spread through airborne transmission, through droplets when an infected person coughs or sneezes. Contact transmission. Touching surfaces or objects contaminated with the virus and then touching the mouth, nose, or eyes. Fecal-oral transmission. Ingesting contaminated food or water. Direct contact. Close personal contact with an infected person, such as shaking hands or hugging. Signs and symptoms. The signs and symptoms of adenovirus infections can vary widely depending on the type of infection and the affected area. Common symptoms include respiratory infections, common cold, runny or stuffy nose, sore throat, cough, and fever. Bronchitis, inflammation of the airways, causing coughing and mucus production. Pneumonia, lung infection leading to cough, fever, chills, and difficulty breathing. Croup, inflammation of the upper airway, causing a barking cough and hoarseness. Gastrointestinal infections, gastroenteritis, diarrhea, vomiting, stomach pain, and fever. Eye infections, conjunctivitis, pink eye, redness, itching, tearing, and discharge from the eyes. Urinary tract infections, cystitis, inflammation of the bladder, causing painful urination and frequent urge to urinate. Nervous system infections, meningitis, inflammation of the membranes around the brain and spinal cord, causing fever, headache, stiff neck, and sensitivity to light. Diagnosis. Diagnosing an adenovirus infection typically involves medical history and physical examination, assessing symptoms and recent exposure to infected individuals. Laboratory tests. PCR, polymerase chain reaction, test, detects adenovirus DNA in respiratory secretions, stool, urine, or blood. Virus culture, growing the virus from a sample of body fluids or tissues. Antigen detection, identifying adenovirus antigens in body fluids or tissues using immunological techniques. Treatment. There is no specific antiviral treatment for adenovirus infections. Management focuses on relieving symptoms and supporting the body's immune response. Symptomatic treatment. Fever and pain relief. Over-the-counter medications such as acetaminophen or ibuprofen. Hydration. Drinking plenty of fluids to prevent dehydration, especially in cases of gastroenteritis. Rest. Allowing the body to recover and strengthen the immune system. Severe cases. Hospitalization. In severe respiratory infections or other complications, hospitalization may be necessary for supportive care, such as oxygen therapy or intravenous fluids. Antibiotics. Only used if there is a secondary bacterial infection. Preventive measures. Hand hygiene. Regular hand washing with soap and water. Avoiding close contact. Staying away from infected individuals. Disinfection. Cleaning and disinfecting surfaces and objects that may be contaminated. Vaccination. While there is no universal adenovirus vaccine for the general public, certain vaccines are available for military personnel to prevent specific types of adenovirus infections. Prognosis. Most adenovirus infections are mild and self-limiting, resolving on their own within a few days to a couple of weeks. However, severe infections can occur, particularly in young children, the elderly, and individuals with weakened immune systems. Early detection and appropriate supportive care improve the prognosis. Management and supportive care. Monitoring symptoms. Keeping an eye on the severity and progression of symptoms. Consulting healthcare providers. Seeking medical advice for persistent or severe symptoms. Follow-up care. Ensuring complete recovery and managing any complications that may arise. Adenovirus infections are common and can cause a range of illnesses. Understanding the causes, signs, symptoms, and treatment options is crucial for effective management and prevention. Practicing good hygiene, avoiding contact with infected individuals, and seeking medical care when necessary can help reduce the spread and impact of adenovirus infections.